Head sores, also known as decubitus ulcers or pressure sores, are a significant challenge in nursing care, especially for patients who are bedridden or have limited mobility. These wounds develop due to prolonged pressure and friction on the skin, often over bony areas such as the elbows, hips, heels, and sacrum. The consequences of bed sores go beyond physical discomfort. They can also impact a patient's mental well-being and overall quality of life. Recognizing the importance of early prevention and intervention is crucial for healthcare professionals, caregivers, and families alike. In this video, we'll explore the causes, risk factors, and most effective nursing practices for antidecubitus prophylaxis. Preventing bed sores is not just about comfort, it's about preserving dignity and reducing complications for patients who are immobilized. Bed sores can lead to pain, infection, and even life-threatening conditions if left untreated. For nurses and caregivers, understanding the importance of proactive measures is the first step. Early prevention can minimize suffering, lower healthcare costs, and improve recovery outcomes. By focusing on risk assessment and tailored interventions, we can make a real difference in the lives of vulnerable patients. Let's look at how nursing care plays a pivotal role in antidecubitus prophylaxis. Patients most at risk for developing bed sores include those who are elderly, chronically ill, or have limited mobility due to neurological, geriatric, or intensive care conditions. Factors such as diabetes, cancer, anemia, obesity, incontinence, poor nutrition, and dehydration further increase vulnerability. Women, especially those over 65, and patients with coexisting diseases or contractures are particularly susceptible. Recognizing these risk factors allows healthcare teams to prioritize preventive care and monitor high-risk individuals closely, ensuring that early signs of skin breakdown are not missed. Head sores form when continuous pressure cuts off blood flow to the skin, leading to tissue damage and eventually necrosis. Friction and shear forces, such as when a patient slides down in bed, worsen the problem. The most common sites are areas where bones are close to the skin, like the heels, elbows, sacrum, and back of the head. Without regular repositioning and skin care, these pressure points can quickly deteriorate, causing open wounds that are painful and difficult to heal. Understanding the mechanics of bed sore formation is key to effective prevention. Bed sores are classified into 4 stages, each indicating the severity of tissue damage. Stage I involves redness and intact skin, while Stage II shows damage to the epidermis and dermis, sometimes with blisters. Stage III extends through all skin layers with visible necrosis and swelling. Stage IV is the most severe, exposing bones, tendons, or muscles and often covered with dark, disintegrating tissue. Early identification of these stages allows for prompt intervention, reducing the risk of complications and supporting faster healing. Accurate risk assessment is the foundation of effective bed sore prevention. Tools like the Norton and Douglas scales help nurses evaluate a patient's likelihood of developing pressure sores by considering mobility, nutrition, incontinence, and overall health. Regular assessments, especially upon admission and whenever a patient's condition changes, enable timely preventive measures. Documenting skin condition and risk scores ensures that care plans are tailored and updated as needed, making prevention a continuous process rather than a one-time task. Prevention starts with regular repositioning of patients, ideally every 2 hours during the day and every 4 hours at night. Using specialized equipment like antidecubitus mattresses, foam cushions, and wedges helps distribute pressure more evenly. Skin care is equally important. Gentle cleansing, moisturizing, and protecting vulnerable areas with appropriate dressings can make a big difference. Nurses should also monitor for early signs of redness or discomfort, as pain is often the first symptom of developing bed sores. Early action is essential to halt progression. Proper nutrition and hydration are vital for skin integrity and healing. Patients at risk of bed sores should receive a protein-rich diet, along with adequate vitamins and minerals such as zinc, vitamin C, and vitamin A. Malnourished patients may require intravenous supplementation or specialized nutritional products. Hydration supports circulation and tissue repair, further reducing the risk of pressure ulcers. Nurses play a key role in assessing dietary needs and ensuring that patients receive the nutrients necessary for prevention and recovery. Specialist dressings, such as self-adhesive foams, hydrocolloids, polyurethane films, and silicone pads, help protect at-risk skin and manage existing wounds. Greasing preparations can increase skin resistance, while drying agents with zinc are used for moist areas. It's important to select dressings and products based on the patient's individual needs, age, and condition. Avoid massaging or applying excessive pressure to vulnerable areas, as this can worsen tissue damage. Consistent, gentle care supports healing and comfort. Physiotherapy is an important aspect of bed sore prevention, especially for patients with limited mobility. Gentle exercises and movement help maintain muscle tone, improve circulation, and relieve pressure on vulnerable areas. Even passive movements performed by caregivers can make a difference. Physiotherapists work closely with nursing staff to develop individualized plans that support mobility and reduce the risk of pressure ulcers. This collaborative approach ensures that patients receive comprehensive care tailored to their abilities. Thorough documentation of skin assessments, interventions, and patient responses is essential for tracking progress and adjusting care plans. Regular monitoring allows nurses to detect early changes, evaluate the effectiveness of preventive measures, and respond quickly to new risks. In intensive care and long-term care settings, this systematic approach helps prevent oversight and ensures continuity of care. Accurate records also support communication among healthcare team members, leading to better outcomes for patients. Patients in intensive care units, ICUs, are at particularly high risk for bed sores due to prolonged immobilization, coexisting diseases, and the presence of medical devices like catheters and tracheostomy tubes. ICU staff must be vigilant, using pressure-adjustable mattresses and regularly changing device positions to prevent localized skin damage. Specialized dressings and frequent repositioning are critical. The complexity of ICU care demands teamwork, attention to detail, and a proactive approach to minimize the risk of pressure ulcers. Palliative care, the focus shifts to maximizing comfort and quality of life for patients in the terminal phase of illness. Bed sores can cause significant pain, odor, and emotional distress. Prevention and treatment strategies are tailored to the individual's condition, aiming to relieve symptoms rather than cure. Regular repositioning, specialized dressings, and pain management are essential. Addressing the psychological impact of bed sores is also important, as patients may experience isolation or depression due to their condition. Bed sores do develop, prompt and effective treatment is crucial. Wound care may involve cleansing, debridement, removal of dead tissue, and the use of advanced dressings like hydrogels or hydrocolloids. Infection control is vital as open wounds are susceptible to bacteria. Pain management, odor control, and psychological support are also key components of care. The treatment process can be long and challenging, but with a multidisciplinary approach, healing and comfort can be optimized. Sum up, anti-decubitus prophylaxis in nursing practice is a multifaceted process that requires vigilance, teamwork, and individualized care. Early risk assessment, frequent repositioning, proper nutrition, specialized equipment, and thorough documentation are all essential. Nurses play a central role in both prevention and treatment, working closely with other healthcare professionals to ensure the best outcomes for patients. By staying proactive and attentive, we can significantly reduce the incidence and impact of bed sores, improving quality of life for those most at risk.